How we talk to and about people with diabetes matters. Whether you're working with someone affected by diabetes, talking with a colleague, or addressing the public, the way you communicate has an impact on the physical and emotional well-being of an individual. Some words can empower and change perception or behavior, but others can express bias or cause stress that impacts overall care, even if they are used unintentionally. To help you communicate about this complex disease, the American Association of Diabetes Educators has enlisted the help of its diabetes educator members to illustrate the role language plays in real-life interactions. A pillar of good communication in diabetes care is using language that is neutral, non-judgmental, and based on actions and facts. To start, consider the words and phrases you use when discussing how a person is managing their diabetes. Are you sharing information that focuses on what the person is doing well? Recognizing good faith efforts is important, and it's equally important to focus on the facts when making suggestions. Be clear about what that means for the person using neutral terms. Now let's watch as a diabetes educator uses these techniques.
Hi Carly, how are you doing?
I'm doing well, thanks. How are you?
I'm doing great. So over the last 3 months, what kind of things have you been doing well and what would you like to work on?
I'd say I'm doing well with the CGM. I finally got it into my routine. One of the problems I'm having managing is my spikes after meals. I just can't seem to get a grasp on it.
Okay, so have you considered maybe looking at timing a dose or carb ratio?
The issue is probably timing.
Okay, so technically we should be dosing 5 to 15 minutes before the meal, but what would you like to work on, to at least just start dosing before the meal?
I would say 15's not very realistic for me, but 5 is definitely somewhere we can start.
Okay, so I'd say let's start there, and then we can reassess in a week if the carb ratio needs to be changed.
Sounds great.
Wonderful.
It's important we focus on what individuals are doing and how they are progressing. Be careful about sounding judgmental or attaching blame to what they aren't doing. When you use person-first language, you remove stigma and show people they are not defined by their disease and they can manage it in their daily lives. Let's look at an example.
Hi Ricky, how are you today?
I'm doing okay, Sheila. How you doing?
I'm doing great. So the last time we met, we talked about you increasing your fruits and vegetables and being able to take them to work with you. How did that work last week?
Worked out okay, actually. After class, I went to the store and bought me some measuring cups, some Ziploc bags, and I started measuring my fruits out in the cups and Ziploc bags and take it with me now.
So that's really great. So now you are measuring out your fruit for your serving size, putting them in a Ziploc bag, and then you're able to take it to work and you're able to have easy accessibility to your fruit.
Right.
Well, that was a great idea and a great plan, so I'm glad it's working out for you.
It works out pretty well.
In healthcare, we're used to thinking in terms of good versus bad, or pass versus fail, but we need to get away from that. Our tone and words should project hope, not despair or judgment. When we use strength-based, respectful communication and avoid scare tactics, we see a positive impact on outcomes. Think about what you can say to foster achievable and realistic, self-directed goals.
Hi Rosa, it's nice to see you again. How are you doing?
Great.
Okay, well, I was looking at your lab results from the last time, and it looks to me like your blood sugars have gone up a little bit from your A1C. Is there anything you want to share about what's going on?
Because sometimes I don't take my medicine on time or I don't eat my meals on time. That's why probably it's too high.
Okay, are you monitoring your blood sugars?
Only one time in the morning.
Okay, I was wondering if maybe you can work in a little bit more, like maybe 2 times a day, because an A1C is an average blood sugar, and we'd like to see a little bit more in order to see what's going on with that average.
Okay, I'm gonna try to do that, checking twice.
Okay.
When providing care, it's important that the individual feels like you're on their side, that you're their partner, coach, and cheerleader. By working together, you can help them reach their goals. So how can you foster collaboration? To start, take the focus off you, the provider, and instead use language that gives credit to the individual for what they've accomplished. Avoid words and statements that are directives, because these can be perceived as patronizing. Use words that build on their strengths and their right to make their own decisions. Let's watch as our last pair collaborates to achieve success.
Hi Janine, how are you doing?
I've been doing fine.
It's so good to see you again.
Thank you.
Last time you were here, we were talking about treating low blood sugars. How has that been going for you?
When I'm at home, there are too many choices, but when I'm not at home, I have tablets with me, and I know to take a tablet right away. So when I'm home and there's cake, cookies, something else that I might want, that's where it gets difficult.
Well, it's good that you have the tablets and that works well when you're away from home. And it sounds like there's some tempting choices at home and not thinking clearly with the low blood sugar. Could you try to use the tablets at home so that you don't have to try to make decisions in the moment? Would that be helpful?
That would be a good idea to do. Not always easy, but it would be the right idea.
Great. Well, let's try that and see how it works.
Okay, thank you.
As you can see, the words and phrases we use make a difference in our interactions. By changing how we use them, we can improve outcome. Just think of language as another piece of the management puzzle we can use to empower people with diabetes and improve their quality of life. So the next time you're speaking with a client, consider these tips and what you can do to make things better. For more information on language and diabetes, visit our website at diabeteseducator.org/language.